Hi, my name is Nicole Anderson, and I'm a current cytopathology fellow here at Geisinger Medical Center in Danville, Pennsylvania. We are a class of 2 cytopathology fellows, and we work directly with cytologists and cytopathology attendings. One of my favorite parts of working here as a cytopathology fellow is that we get to provide care to patients in both the clinic setting and our fine needle aspiration clinic, and also in interventional radiology and endoscopy doing rapid on-site evaluations. For rapid on-site evaluations, we go either to the endoscopy suite or interventional radiology, and we employ telecytology. With telecytology, we use an iPhone to call our cytopathology attending, and we show them the cells that we're looking at, and they're able to provide us feedback about what we're looking at or what we think the cells are. And then we're able to provide direct information to the proceduralist about whether or not they're in the lesion or if we have enough sample to make our diagnosis. They find it very helpful, and it's pretty rewarding. Another great part about our program is that we get to go to our fine needle aspiration clinic, where we see up to potentially 5 patients per week, and our cytopathology attendings are there with us. They're able to help us learn to palpate lesions and do the fine needle aspiration technique correctly. And we're able to provide information to that patient's provider same day. And we see about 30,000 GYN specimens per year, about 7,000 non-GYN specimens. We do 4,500 fine needle aspirations, and of that we do about 4,000 rapid on-site evaluations. What I really love the most, honestly, is working directly with the cytologists and the cytopathology attendings. Everyone's very engaging and loves to teach. So I hope you look into coming to Geisinger.